Most of you know that every month I give away some of my favorite products to some that simply rate and review this podcast. And this month, I am sending out 7 Sundays grain-free cereal and granola. These are all of their top selling items, including their real cacao, maple sea salt, simply honey, Daydream dark chocolate, raspberry nut granola, and their Rise and Shine strawberry banana nut granola. You guys, if you haven't tried any of these, this is your chance. It is so freaking good. Just give this podcast a 5-star rating and review. And every last episode of each month is where I will be announcing the winner. So don't miss those episodes because you may miss me announcing that you are the winner. Good luck.
So those gut bacteria, if you have a good community down there, everything's going to work nicely. If you have an illness, you eat a lot of sugary things, a lot of processed foods, it's like a gang moved in and they're going to be like disrupting everything. Giving the right balance of hormones is going to protect that.
Every woman needs to listen to this episode, and I don't say that lightly. Today, I am talking with Dr. Lorraine Maita, who specializes in hormone replacement therapy, and we discuss the reasons why women should go on HRT, such as not only helping bone loss, but actually reversing it, perimenopause, menopause, helping you get pregnant and carry a child to term, and what hormones do for our body beyond reproduction, such as sleep, depression, and even digestion. We also talk about the best ways to get your hormones tested because blood just isn't enough to measure. Even the methods to take estrogen are important, and taking the pill is actually not recommended. So we talk about the safest ways to do that and if there are any risks involved in hormone replacement therapy. I know that there's a lot of stigma around it, especially when it comes to breast cancer. So we get into that as well. Whether you are 20 or 80 years old, you need to be informed in what we discuss in this episode, and it can certainly help every single person who listens. I can guarantee that. So let's get right into it. And you guys know this already, but you're listening to the Digest This podcast, and I'm your host, Bethany Cameron. Well, thank you so much, Lorraine, for coming on the show today.
Thank you for having me. I'm so excited to talk to you and to talk to your audience.
Yeah. So before we even dive in, I like to start my podcast with some rapid fire yes or no questions. And you can only answer yes or no. Are you ready?
I'm ready.
Okay. First question. Is bone loss reversible?
Absolutely, yes.
Wow. Is it true that HRT increases your risk for breast cancer?
No.
Wow. Okay. And do out of balance hormones make you gain or lose weight?
Yes.
I can't believe that we are now getting into fall, if not feeling like we are in fall already. And I love it, but it does come with some doom and shorter days, less sunlight. And I know we can all feel the depression and anxiety kind of kick in, some more than others. And if you're one that certainly notices a change in your mood when the cooler months come, I totally feel you. So, how do we combat this? Obviously, we want to be around people. I think diet and nutrition play a huge role, but I also think people overlook hydration. And studies have actually shown that when you are dehydrated, specifically when you don't have enough electrolytes, anxiety, depression, you might feel irritable, lightheaded, fatigued, having headaches, panic-like symptoms. These can all be signs of just low electrolytes. Also, flu season. As we get into the fall and winter months, a lot of people can get the flu and get ill. And then when we are sick, we do lose a lot of water and a lot of electrolytes. So I always recommend Element. I use the unflavored packs. I know a lot of people do prefer the flavored versions. Again, do what works for you. I like the unflavored, which is just 3 simple ingredients. There's no stevia, there's no natural flavors in their raw version. They do have other flavors. If you do need a little flavor or a little sweetness, they have that as well. And I'm always talking about it in my Instagram stories, but you can get a free sample pack. So if you haven't taken advantage of this offer, just go to drinkelement.com/digest to get this amazing offer. Again, that's DRINKLMNT.com/digest, and you can get a free 8 single serve sample pack. Adding electrolytes is a great way to replenish and rebalance your entire body, mind, and mood. I hope you guys love them as much as I do. If you're a foodie like me and looking for a safe, natural sweetener to add to your drinks, desserts, oatmeal, smoothies, and basically anything you want sweetened up, then listen closely. I've got a recommendation that not only will add sweetness to your life, but also add loads of health benefits. Manucora contains powerful nutrients to support immunity and gut health, contains 3 times more antioxidants than your typical sweetener, and also contains a special antibacterial compound called MGO. If you haven't guessed by now, Manucora is a special type of Manuka honey ethically produced by master beekeepers in the remote forests of New Zealand. This honey is rich, creamy, and may just be the most delicious honey you've ever tasted. This isn't just your average honey, though. I mean, we all know that raw honey is great for you, but raw Manuka honey is even better because of the MGO found in Manuka honey specifically. And what I love about the brand Manucora is that they do third-party testing for every single batch, ensuring the potency of the MGO claimed. And they even provide those specific test results on every jar through their QR system. So you can check out the batch you have in your exact hand. That's a pet peeve of mine personally. Like when companies say they do third-party testing, but they only do it once on one batch, only to find out later that the batch you purchased wasn't even tested. But you can be sure Manucora goes the extra step to provide results for every batch on every jar, providing you with the most delicious, antioxidant-rich, and antimicrobial healing honey. This stuff is a game changer and easier than ever to incorporate into your diet. All you need is 1 teaspoon each morning to benefit from the amazing bioactives in Manucora honey. Head on over to manucora.com/digest to get $25 off the starter kit, which also comes with an MGO of 850 plus Manucora honey jar and 5 travel honey sticks, plus a wooden spoon and guidebook. That's Manucora, spelled MANUKORA.com/digest to get $25 off your starter kit. Manucora.com/digest. That was just 3 questions, and I feel like that's just enough to pique my listeners' interest. And it's really interesting because even the first question is, so many people say bone loss is not reversible. It's when you lose it, you lose it. That's it. That's it. So I want to get into that. But first, why don't you introduce yourself and tell my listeners who you are?
I am Dr. Lorraine Maita. I'm a triple board certified physician, and I'm certified in anti-aging and regenerative medicine, internal medicine, integrative medicine, and I've been studying advanced endocrinology and doing hormone replacement therapy for a very long time. So I saw all the trends come and go. And I used to be the chief medical officer of 3 Fortune 100 companies. And when I first started, I came out of the emergency room in New York City. I knew I could save your life. I could treat any kind of infection. I could help you with so many things. But when I came to this corporation at the time, there were very few women executives. And one of them, who was just, so highly regarded, came down to me and said, "You have to help me. I am standing in front of a whole group of men doing a presentation, and I got a hot flash. I was sweating. I couldn't remember my words. I couldn't I couldn't think. And the guys were either looking with their eyes cast down, like, oh my God, I can't see this. I can't look at this. Or they were elbowing each other, chuckling. And she said, nobody will take me seriously if I can't command the room. You've got to help me. And that started my journey. And then, of course, fast forward, I went into perimenopause. Nobody talked about perimenopause. Same stuff as menopause. And let me tell you, it was a wild ride. And that really got me going into learning even more and going deeper. And I've helped thousands of women and even men. And it's been a transformative experience. And it's so gratifying. That's why I'm never going to retire.
Man, I mean, you are doing so much work. And what age does perimenopause typically start?
Most women in their 40s, but I've seen women starting at younger ages and even in their 30s. And some have premature ovarian failure where their ovaries just give up early in their, late 20s, early 30s. But that's a really dangerous time of life and nobody talks about it. And women have no idea what they're going through. And they go from doctor to doctor with all these disparate symptoms. And when you put it all together, it's perimenopause.
Wow. So I know you specialize in HRT. And for those that don't know what HRT is, it's hormone replacement therapy. And explain what HRT is and what is prescribed, because is it safe to say it's medication? Because there's medication, but there's also BHRT, right?
Yes.
And so explain the difference between
Okay.
HRT and BHRT.
So I go way back to when HRT, hormone replacement therapy, was Premarin and Provera, and that was horse urine and synthetic progestin, right? It was made from horse urine, and these were synthetic forms because they didn't have the technology then that acted like estrogen and acted like progesterone in some ways, but in different ways, they brought on different effects because that's not what your body recognizes as its own hormone. So, yes, it depends on how you define medication, but bioidentical hormones are the exact same chemical structure as the hormones in your own body. And those hormones act the way the hormones should act, and your body recognizes them as, okay, I was missing this and now it's back and I feel good. So those hormones act the same way as your own. They're given in a different way, but they have this, we understand their effects and they have less different side effects. The side effects occur when they're out of balance. It's not necessarily from the hormones themselves.
Okay, so where can one get bioidentical hormones? Because can you just go to your regular like OB or and say, I don't want the HRT, I want BHRT. Can they prescribe them? Or do you have to go like quote like off, black market and try and get them?
No, actually, now pharmaceutical companies have jumped on the bandwagon and they make BHRT. So when estrogen BHRT is estradiol. So they make it in gels, they make it in patches, they make it orally, but I'll get into that later. Oral estrogen is not good for you. And so you can get that from your OBGYN. Progesterone is also made, but it's only made in very restricted doses. It's either 100 milligrams or 200 milligrams. And if you need something in between, you have to go to somebody who really understands compounding, meaning you can make the exact dose that works for you. And unfortunately, a lot of OBGYNs are not trained. They're literally not trained. They're trained in how to give the pill because the pharmaceutical representatives come in. The studies were done on the pills. They're very good at that, but because it's quick. And,
Yeah.
many of them answered, they did a survey, and most were not trained at all in menopause or perimenopause.
So, yeah, I definitely want to get into why you shouldn't take estrogen or estradiol orally, but also for the progesterone. If someone is prescribed progesterone, what should they look for that's bioidentical? Because I think there's like prometrium, there's also like other names for it. And what's the category? What should they want as progesterone?
The generic name should just say progesterone and not have any letters before it or after it. The most common one, Provera, was medroxyprogesterone, and that's where they did a lot of the studies on. And that increases the risk of breast cancer.
Okay.
Because it's synthetic. But anything that
Provera.
just says micronized progesterone or progesterone by itself, Prometrium was the brand name. They no longer, very rarely do you get the brand anymore, but it has to say just plain progesterone. And
Okay.
my big beef with the press is when they publish things and say things about progesterone, they call everything progesterone, even if it's synthetic. And we call it progestins or progestogens because they're not progesterone.
Interesting. Okay. Yeah. So if they do have like Prometrium, that's fine.
Yes.
Um, okay. Interesting. Now, for a lot of my listeners, they're like, okay, well, why would I even care about HRT? Why should I? So, what are some reasons people go on HRT? Maybe beyond, you know, well, let's just name a few reasons. Why would someone need or want to go on HRT?
So most commonly, and this is how it was decided to prescribe it, hot flashes, night sweats, dry eyes, dry skin, dry vagina, poor memory, but also people who have an increased risk of cardiovascular disease. There are more and more studies saying that it decreases the risk. It helps the arteries not become so thick. It decreases heart attack and stroke. It increases bone strength. It also decreases the risk of certain gastrointestinal cancers, which is pretty much unknown. But people take it to preserve their bone, their brain, their cardiovascular system, and most of all, their mood and self-esteem, because women lose themselves. They get anxious, they get depressed, they feel like somehow or other the lights went out and they no longer have desire. They no longer feel engaged in life. They feel bad about themselves. So their self confidence and self esteem plummets. So there are a lot of reasons to go on HRT. And then there are some anti aging benefits, right?
hmm So I know you mentioned, bone loss, and if you have osteopenia or osteoporosis, is this something that you should consider?
Absolutely. In fact, in Europe, it is the number one priority. That is the treatment of choice. Whereas here in the US, people got scared after that Women's Health Initiative study because women took oral estrogen and that causes clots. It increased the risk of heart attack and stroke. And they gave synthetic progestins, which increased the risk of breast cancer. But that's not how we do it now. So when you look at the benefits outweigh the risk. Even the North American Menopause Society and 20 other organizations say the benefits outweigh the risk, but it's not necessarily, it hasn't caught on, that misinformation got out and it's very hard to correct that. So now there's been lots of studies of the last 3 to 5 years that the benefits outweigh the risk. It's safe to take. And in Europe, it's the drug of choice for osteoporosis. And we're stuck in the old model where we're using these other drugs that may benefit your bones, but they don't have all the other benefits that the hormones have.
Yeah, and they may have other risks and maybe bigger side effects as well when trying to treat osteoporosis. Now, I asked again at the very beginning, can bone loss be reversed? Now, is this proven?
Absolutely. Well, I've been doing this for over 30 years, right? And I was there in the days when that was the drug of choice. Then the Women's Health Initiative came. Every woman got off their hormones. Nobody knew what to do for bones. They did the bisphosphonates, but I have been following women giving bioidentical hormone replacement for a very long time. I treat the other things, your digestion, your absorption, your calcium levels, your vitamin D levels, your acid base. And I see women go from osteopenia to normal bones, from osteoporosis to osteopenia. I've been seeing it forever. And this is my big beef because women go to other doctors and the doctors say they don't work. But I have 30 years experience. Plus the studies show and prove that these hormones work and they decrease the risk of fracture by 20 to 40%.
Wow. So, my question is, so why do these doctors say flat out, no, hormone replacement therapy doesn't work for osteoporosis and bones? But then obviously there's studies and you've seen it firsthand with your clients, correct?
Yeah, absolutely. Every day. I do this all day, every day for decades. So a lot of them, I invested in a lot of time and effort and money to study this and to study it in depth. Meanwhile, a lot of people come out of medical school. What you're taught in medical school stays with you, and you don't evolve, right? Or some they're used to something and they go with what works. I mean, I've always been a little bit of a tinkerer, so that I'll look into, well, maybe this might work better. Or, I tend to get people who failed other treatments. So I have to look for a better way or a different way. And I'm a lifelong learner. So it's a lot of time and effort to study these things, but I study the studies so my patients don't have to. And I give my patients a list of the studies because they're going to get backlash from their family, from their friends, from other doctors. And when they see these studies, they're like, oh my God, there is
Yeah,
something
it's
to it.
it's really hard, I think, for anyone to kind of unlearn what they've been taught. And it's
Yes.
almost like a mind shift. And you're like, wait, what? Like everything that I knew was wrong.
Yes.
I'm speaking about, doctors, and maybe it's hard for them to realize that. Now, I also want to ask how long, let's say, does HRT work if you are trying to reverse bone loss?
You start to see a significant difference after a year. I mean, it's not fast. It's not like bingo. But in 3 to 5 years, it's even more so. So the thing is, you do other things in between because it's not just one thing. As I tell people, maintaining your health is not one thing. So I have some women who come to me, just give me the hormones. And it's like, no, we have to know what your body is doing with the hormones. Every other part of your body has to work well. You have to digest, you have to absorb, you have to eat right. And, we have to make it a habit so that it's like breathing and it's not work. So there's definitely big changes and I see it every day.
Wow. Yeah. And that's a good point too, because you can't just think, oh, well, this is just going to be a quick fix. I can continue eating the way that I am or being sedentary or whatever and think it's going to work. Now, is HRT, is it just, I think there's a misconception, and correct me if I'm wrong, but is HRT just for older women going through menopause or for bone loss? Or can younger women take it for, because I've heard that a lot of people do this for IVF or trying to get pregnant or things of that nature.
Yes, oftentimes fertility issues when women can't hold a baby to term is a lack of progesterone. There are so many hormone disrupting chemicals in our environment, and inflammation is also the root cause of a lot of illness. And there's so many things that cause inflammation, so that women who can't hold a pregnancy are given bioidentical progesterone as injections throughout their pregnancy. Postpartum depression. Oftentimes, the estrogen is easy to make in the ovaries. Progesterone is a dance with all these factors where the egg has to ripen and gets the signal to burst, and you make a corpus luteum and you make progesterone. So, making progesterone is kind of hard. So, some women have ovarian failure, some women have polycystic ovarian syndrome and they can't make progesterone, and other women have what they call anovulatory cycles, meaning they'll cycle and they'll bleed and they'll think their periods are normal, but they're not ovulating and they're not making progesterone. And progesterone is just as important for bone health as estrogen is. In fact, most bone is lost in perimenopause, which precedes menopause by 10 years. And women don't even know they're in perimenopause.
Now, how do we get checked? Like, how do we know if we're not ovulating or not?
Sometimes you know by symptoms, and I measure. I always measure, and in a 28-day cycle, I measure estrogen, progesterone at day 19 to 22 because that's when both should be at their peak. And you want to look at the balance. You want to look, do you have enough progesterone to balance that estrogen? And there are about 35 symptoms of menopause, and there's also that many symptoms of perimenopause. But most women say, I don't feel like myself anymore. I feel out of control. I'm anxious. I can't sleep. I'm gaining weight. Some get hot flashes and they'll go to the GYN and the GYN will say, well, you're not in menopause, but hot flashes are fluctuating hormones. So women don't always know. One went to a cardiologist and several cardiologists because she was getting palpitations. Some women get creepy crawly feelings on their skin. Some women get but it's the most common are anxiety, irritability, impatience, insomnia, growth of the breast, cysts of the breast, tender breasts, bleeding, spotting, weight gain, fibroids, irregular bleeding, heavy bleeding. So when you start feeling you're off, there's something wrong, and somebody tells you you're normal, go to somebody who can measure.
For reals, like if you're not feeling normal and you're being told you're fine, obviously seek someone
Yeah.
else.
Yeah.
And so hormone replacement therapy can help all those
Oh, absolutely.
issues.
I use it sometimes in PMS, although in younger women, I try to get their progesterone to kick in with herbals. I don't want to always put
Mhm,
people on hormones, but when they need it, they need it. So we give a trial of that. But
mhm.
it's wonderful for PMS, for perimenopause, for polycystic ovarian syndrome. So in the beginning, what you need is progesterone during that perimenopausal or PMSE phase. Whereas then when you hit menopause, the estrogen drops. So you give both. And in some women, I give testosterone as well, because testosterone is also important for bone.
Yeah, well, and I think a lot of women don't realize that women also produce testosterone and need it,
Yeah.
not to the extent of men, but it is something that we also utilize. And you did bring up something that I wanted to ask too is, for younger women, maybe trying to regulate their hormones, right? Is this an option or is this something, maybe for people 25 and up, or, is this for people maybe 20, 17, or do you try to regulate your hormone? I know you said you would prefer the more natural ways,
Yeah.
but is this an option for someone trying to regulate their hormones?
It is, but that's not where I would start in someone who's
Mhm.
younger. I want to decrease inflammation and I want to reduce stress because
Right.
when cortisol, the stress hormone, is high, it's going to lower estrogen, progesterone, testosterone. So
Mhm.
I also measure cortisol. So if cortisol is high, I give, lifestyle techniques, dietary techniques, adaptogenic herbs, nutrients to help with managing the cortisol, but you have to know it's high or it's low to know what to do for it. And then if you get the cortisol in the right place, your other hormones will just balance back naturally. If you eat a proper diet, anti-inflammatory foods, the inflammation decreases, people lose weight, people get mental clarity back, they feel more in control, and their hormones will work better. And if you reduce the toxins, like we're exposed to over 200 toxins per day, and they disrupt your hormone system, your immune system, and your nervous system. So
Yeah.
ditch those plastic bottles. Don't eat in
Yes.
plastic. And there's so many more things. Yes, even I, when Starbucks gave cups, I had my drinks there in ceramic cups, or I brought my own.
This is quite interesting and a little heartbreaking, but approximately 92% of Americans are nutrient deficient, and nearly 50% are deficient in vitamin B12 specifically, which can lead to issues like anemia, vascular disease, stroke, autoimmune conditions, fatigue, and dementia. B12 is the only vitamin that we cannot get from plants or sunlight. It is the only vitamin found in animal products. And the richest source of natural B12 on the planet is grass-fed beef liver. In fact, severe B12 deficiency used to be fatal until scientists figured out death could be prevented by feeding patients raw liver. Now, I'm not going to eat raw liver, and I'm sure you aren't either. But I am a huge fan of consuming meat organs. However, I know most have a difficult time with either the taste of them or just simply digesting them. But organ meats such as liver, heart, kidneys, and spleen are some of the most nutrient-dense foods in the world. I would hate for myself or anyone to go without them in their diet. That's why I personally opt for Equip Foods grass-fed beef organ capsules. It's a blend of grass-fed heart, kidney, and spleen that's dehydrated and put into a capsule form to easily be consumed with any meal or a glass of water. Just 3 ingredients and no fillers, no flow agents, and no additional ingredients are added. No antibiotics, steroids, or hormones. They're also gluten-free, grain-free, soy-free, dairy-free, non-GMO, and gently freeze-dried to preserve the nutrients, making them bioavailable for easy digestion and absorption. They're easy to swallow with no flavor or aftertaste. Equip Foods has liver capsules as well. So if you're particularly interested in upping your iron, grass-fed organs are the best option there is. They're rich in vitamin A, vitamin B12, coenzyme Q10, heme iron, and selenium. These nutrients provide a multiple of benefits for immunity and vitality. If you're not sure about them, Equip Foods has a 30-day, 100% money-back guarantee. So if you aren't thrilled with your order, just let them know and they'll refund you without any questions asked. You really have nothing to lose and all the health to gain. If you go to equipfoods.com/digest and use code DIGEST, you will get 20% off your order. Again, go to equipfoods.com/digest and use code DIGEST for 20% off. That's equipfoods.com/digest and use code DIGEST. People don't realize even those paper cups, they're lined with plastic
Yes, they are.
inside because otherwise the drink would just go through the paper. Now, I had a friend too, and she was going through, they were trying to get pregnant through other means. And so she had to go on hormone replacement therapy, and it worked for her. Like, they got pregnant through the non-conventional way. And so for those trying to get pregnant, this can obviously help with that, because if you go on HRT or BHRT, you can get pregnant, correct?
Absolutely. But you can get pregnant if you take care of your cortisol, if you decrease the inflammation, if you decrease the toxins, if you get enough sleep, if you're, eating a healthy diet. I have a lot of people who came to me, I don't do fertility, but you know what? They came because they couldn't get pregnant and they didn't feel right. And you know what? We fixed them. They changed a few things and they got pregnant. And then,
Yeah.
if those things don't work, then yes, by all means, go on to hormones. But I'm not
Yeah,
saying everybody should be on hormones for every little thing.
for sure. Now, for those listening, maybe someone's like, okay, I don't have bone loss. I'm not trying to get pregnant. I'm not going through menopause. Like, why should I even care about hormones? Besides reproduction, what role do hormones play in our body? For example, like we know it plays a role in bone health, but I know sleep, better digestion.
Yes. Well, when so many things happen when your hormones fluctuate, and women have a more a tendency to develop autoimmune disorders, and it's because of estrogen. So if you balance everything, your risk of autoimmune disease goes down. Risk of cardiovascular disease goes down. I give women estrogen and progesterone to lower cholesterol. Their heart health is better. Everywhere you have an estrogen receptor, you have a progesterone receptor, and there are a lot of them and in the brain. So people do it for mood. It improves your mood, because I see a lot of women in menopause depressed or anxious or both, and a lot of perimenopausal women really anxious. So it helps with your brain health. And in fact, they're using hormones. If you have an accident or brain trauma, progesterone has been used to protect. Also, estrogen is used in dementia now. I have some older women who are just suffering, and there was a myth that it's not a myth. You do better the earlier you start, but I have some women who are losing their memory and getting demented, and we're giving them estrogen even after the age of 60, and it it helps. It preserves brain, it preserves bone, it decreases the risk of several gastrointestinal cancers. People like it for their skin. They feel more youthful. Um, memory.
I wanted to talk about digestion just for a second because I heard that I was reading some studies and they said that hormones can help the gastric juices in your stomach and they help regulate that. I don't know if you've heard or read anything about that.
I do know that it changes the microbiome, and it changes the microbiome in your mouth. So a lot of women get dry mouth, burning tongue. Your digestion starts in your mouth, and it changes the whole oral microbiome. And then you can get bad breath, you can get tooth decay, you can get bacteria overgrowth, and then that gets into your circulatory system. So it can travel and increase the risk of different types of infections. In the gut microbiome, it definitely changes that microbiome. And that microbiome, there are more of those cells in your gut than in the cells in your body. And there are more nerve endings from your gut to your brain than from your brain to your gut. So those gut bacteria, if you have a good community down there, everything's going to work nicely. Your hormone system, your immune system, your nervous system. If you have an illness, you eat a lot of sugary things, a lot of processed foods, you're going to change the neighborhood down there. It's like a gang moved in and they're going to be like disrupting everything. So giving the right balance of hormones is going to protect that. I personally haven't read anything about the gastric juices, but I get a lot of women with issues in their mouth and issues in their gut. And sure enough, the hormones really help that.
Wow, it's amazing how much hormones play a role in our overall health beyond reproduction and menopause and all of that. And I think a lot of people just don't realize it. Now, I want to talk about, we briefly touched on good versus bad ways to take the estradiol and progesterone. There's patch versus pills versus creams. So let's get into that.
Sure. When you give estrogen orally through the mouth, it goes first pass through the liver, and the liver is going to make clotting factors, which increases the risk of heart attack and stroke, right? If you form a clot, the clot breaks off, it goes into your brain, you have a stroke. If the clot goes into your heart, you have a heart attack. And that also it's true for birth control pills. It's pretty obvious on birth control pills that there is an increased risk. And I can't tell you how many people had thrombosis and then they have pulmonary embolism because of being on the pill. And if you smoke and are on the pill, it's even worse. However, now we're giving estrogen. I mainly give it through a patch through the skin, a patch on the skin or a gel on the skin, or when people can't take the pharmaceutical doses, I'll have a compounding pharmacist make a cream. When it goes through the skin, the risk of clots is negligible. Oral estrogen also increases the risk of gallbladder disease. If you give it through the skin, it doesn't. So that it's much safer and it's much, it's easy to take and you're getting all the benefits without the risk.
Now, do you think the studies that are all about, negative, about maybe like blood clots and all of that, is it just done on the oral? Did they do studies on the patches or creams?
Yes, absolutely. And
They
that's
did.
why
Okay.
there are many, not so much the creams because those studies cost a lot of money. So who's going to fund that kind of study, right? The patches and the gels, there are a ton of studies, and they understand when a pharmaceutical company makes a drug, because I used to work in pharma, they make a drug, and if it's in the same class, all the dangers from that class are going to go on the new drugs, right? Even if they know now, and studies have proven that estrogen through the skin, transdermal estrogen, the risk of clots is negligible. Nobody can say never. You're going to still see that on the package insert that it causes clots and all that. And that's really where for them to change a label or a package insert is so much money. They just leave it there. And, you have to go to experienced people who understand and know how to use these things and follow the studies and keep up on the data and also have the experience. I've never had anyone have a clot.
Yeah. Now let's talk about, so definitely do through the skin when you're taking estrogen or estradiol specifically. Now, what about progesterone?
I like giving oral progesterone. because most women complain of anxiety and lack of sleep. And let me tell you, when you take progesterone at bedtime, you get the best sleep of your life. You really do. It's like people are like, oh my God, I slept.
Wow. Okay.
Yeah.
So oral doesn't really have a negative effect like the estrogen would.
No, no. In fact, the natural bioidentical progesterone does not cause clots. It does not cause issues with the gallbladder. It actually relaxes the cardiovascular, the arteries. So it's
Mhm.
helpful for high blood pressure. It decreases the risk of diabetes. It doesn't have any of the side effects that the progestins have. Most people tolerate it beautifully, but there are some people that may have weird dreams. They may get nauseous. I have some patients that are super sensitive to everything. And we need like micro doses. And they might get, it's rare. I'd say only like 5% of my practice. I'll make progesterone into a cream. The downside of that is it's harder to measure. You can only measure it in saliva. And it tends to like to stay in your fat. So everything could be going fine. It's good, it's good, it's good. And then all of a sudden you puff out, right? Because you're just sort of builds up. So that's the importance of measuring and knowing how to measure which tests to do for whichever type of hormone you're on.
Okay. Now, does it matter when you take them? Like, are you taking them every single day out of the month? Or like the patch, I'm assuming, is constant?
I usually give one day off. Cycling is better. So some women just cannot, even the one day off, they just don't feel as well. They don't sleep as well. But you know, there are studies that 2 weeks on, 2 weeks off is good, but that's good when you're cycling, right? And I do that with perimenopausal women. However, our brains are used to fluctuating hormones, and the receptors get tired. You know, if you're constantly stimulating the receptors with hormones, they don't work as well. So I always give one day off. It gives your liver a break, it gives the receptors a break, it gives the brain a break. You clear them, and then you're resensitized to them. So that has been very well tolerated for most of my patients.
Okay. So both hormones typically you're taking every single day out of the month, or you said,
6 days a week. So
okay,
you're skipping one day a week. And then if
got
you
it.
are having a period, you have to do it, you know, the first week, estrogen is low, so you don't need the progesterone to balance it. But starting, you know, the second week, the second through the second and third week is when estrogen goes up. That's when you need to take the progesterone. And then when you stop, when estrogen starts to drop, you stop the progesterone. And then you have a week where, you know, the hormones are dropping, you shed your uterine lining, you have a period. So those are 2 weeks on, 2 weeks off. Of course, you have to adjust for cycle length, but um, it's
Okay.
that's the best way to do it. But in menopause, when you're not making either, I do it 6 days a week.
Okay. So menopause, it's mostly constant. If you are maybe doing IVF or trying to get pregnant, it's best to do the cycling.
IVF is a whole different ball game.
Okay.
So
I know
with the
that's not your
cycling,
specialty.
yeah, no,
What about bones?
but bones, it should, you know, the bones, it would be treated the same way because in perimenopause, you're making estrogen. So as long as you have adequate estrogen, that's good. You have to balance it with progesterone. And if your testosterone is low, I will give testosterone as well, or
Okay.
DHEA, because all of them have an effect on the bone. Um, so I just, yeah, I mean, that's how I do
Okay.
it.
Now, I know we've talked a lot about the benefits, but what are the side effects of taking HRT? Like, are there, can you gain weight from going on hormones? Can you have like cramps, diarrhea, swelling in the legs? Like, what are you know what I mean? What have people experienced?
Okay, so if the hormones are out of balance, think of estrogen as a hormone of energy and growth. It's the gas pedal. It's you get up and go. If you're estrogen dominant, meaning if your estrogen, it could be high, normal, or low, but if you do not have enough progesterone to balance it, it's dominant. So estrogen dominance, that will make you gain weight. That will make you hold fluid. It's like PMS. anxiety, irritability, impatience, insomnia, growth of the breast, cyst of the breast, tender breast, growth of the uterine lining, bleeding, spotting, weight gain, fluid retention. What that means is either you have too much estrogen, which my big beef is you got to move your bowels, you've got to have an active gallbladder, you've got to have enough fiber and cruciferous vegetables to keep estrogen in check, or you need more progesterone. Now, if you have too much progesterone, progesterone's like the brake. It balances the estrogen. Too much progesterone is the hormone of peace and calm, but too much peace and calm, you're groggy, you're foggy, you might find it hard to get motivated, you might have nipple tenderness or pimples. So I teach my patients this so that they're in control of regulating their hormones through adjusting the dose or changing something in their diet or their lifestyle. So that's what, but when they're balanced, everything is beautiful, right? Your car runs beautifully when you have good brakes and good gas pedal and you've got the right fuel and everything is working smoothly. If you're trying to drive with your foot on the brake, it's not going to happen. And if you have your foot high on the gas pedal and you're trying to brake, you can't. So that look at it that way. If you're balanced, everything is beautiful. If you're out of balance, then all those things can happen, but we know how to fix it.
Okay. For example, like my friend, she was experiencing leg swelling when she was doing it. Is that, and she was like, I'm like positive it's from the HRT. Is that
It can be.
common or not?
It's not common, but you can get fluid retention.
Interesting.
But she's probably not getting enough progesterone or the estrogen is too high. And she
Mm,
also might have venous insufficiency, meaning the veins are just losing their elasticity and the blood pools. So there are other reasons as well. But yes, you can have fluid retention when your hormones are out of balance. And going to somebody who really knows how to tweak is very
mhm.
helpful.
Yeah. And then you had mentioned pimples. Is it common to get really bad acne when you go on these hormones? Or maybe your hormone, or maybe your acne goes away. I don't know.
Well, it depends. You know, there are 20% of women when they enter menopause will have acne and they end up with higher testosterone. Most women have lower testosterone, but 20% will have higher testosterone. And there are things to do for that, but that means sometimes you need more estrogen. All of our estrogen is made from testosterone. So, women actually make a lot of testosterone, but it's the enzyme that converts it to estrogen that can be a little bit off.
Okay. Now, how do we get tested? Like, what are the best methods to test your hormones and most accurate?
Each test tells you a different thing. So I test 3 different ways at 3 different times. Blood is like, I use the analogy. If I were to do your financial plan, I have to look at your bank account, your savings, and your income and expenses to do a good job, right? Yeah, that's the complete picture. So if I'm looking at your hormones, blood is the most studied. It's easy, it's done. It's all the studies are done on blood, but that's like your bank account. You have it, but is it going in the right places? What is your body doing with it, right? So I always start with blood because that's going to tell me what levels do you have, right? But that's hormone bound to protein plus free hormone. It's only free hormone that gets into the cells, and some women are savers. They hold on to their hormones because of the proteins, and while it looks like they have enough, it's not really free to go into the cells. So then I measure the blood next to saliva. Saliva is only free hormone. Not as many studies on that, but when you can't figure something out, you measure it 2 ways. You take a different look. And some women have high saliva, high hormone levels in saliva and low in blood, or high in blood and low in saliva. Some match. So it gives me an idea what is happening with the women, how much is converted to free hormone. And then I'll also do urine. Urine is very interesting because it's telling me what your liver is doing with the hormones. Your liver is a giant recycling plant. It's going to take your estrogen, whether I give it to you or even women not on hormones make a different type of estrogen that's not so friendly in the fat and adrenal glands. So all these estrogens are going to be recycled in your liver, and they can go 3 ways. Clean recyclables, 2-hydroxyestrogen, really toxic byproducts, which is 4-hydroxyestrogen. And when women make 4-hydroxyestrogen, it increases, they've shown those women either had an increase, they either had a family history of breast cancer or a history of breast cancer. So we want to know, what is your liver doing with these hormones? Because if you're making the toxic form, I can give you lifestyle and diet and supplements to change it into the non-toxic form. And then just like any garbage, you have to put it in a bag so the garbage man takes it. The hormones have to be detoxified so that your body can get rid of it. And I can see all of that in the urine.
Oh, wow.
Yeah.
And is it pretty taxing on the liver if you take HRT?
Too much could be, the thing that's more taxing is that's why I detox everybody before I give them hormones, because it's like this, it could be for some people the straw that breaks the camel's back. If you're
Mm,
not eating organic, if you live in a polluted environment, if you're using toxic personal care products, toxic clean products, everything that we come in contact with has some kind of chemical. The liver is overburdened, and then you add hormones on top of that. Not everybody reacts very well in the beginning, but when I detox them first,
mhm.
wow. I mean, first of all, they feel good to great. 80% of people in 2 weeks feel good to great. And then I feel comfortable giving them hormones because they've unburdened their liver.
Mm. Now, when you start giving someone HRT, is there an adjustment period? Like, does it take a couple weeks for the body to like kind of like balance out, or no? Is
Yeah,
it is
yeah.
it like a gets worse before it gets better type of thing?
Well, yeah, some people, like I've been doing this for over 30 years, so I can pick a dose to start with, and everybody with the same levels, 10, 20 people with the same levels, I could give them the same dose, they're all going to react differently. So most of the time they feel good right away, and hormones reach their peak effect at the 2 month mark, which is then I measure and then we tweak. Well, we tweak
Mm,
based on symptoms. So most people get regulated pretty quickly and feel a difference pretty quickly, like their hot flashes will go away, they'll get a good night's sleep. Maybe we need a little bit of tweaking. And some people, especially those who have a lot of stress, have an erratic lifestyle, have an erratic diet, they may take a little bit longer, but always it's 2 steps forward, 1 step back. They're always improving, but we got to wait till we get to perfection. And for some people, it takes time. But I tell you, most people, they feel good right away.
okay. Now, if someone is considering taking HRT or looking into it, or maybe they're already on it, how do you go off of it? Because, I'm sure people are wondering, well, maybe this is something I want to do, but I don't want to do it for the rest of my life. Like, you can't just quit cold turkey, right?
Some people do. I mean, some people
Oh, wow.
do. But I usually wean people when they want to go off or when they have to go off, but it's pretty rare. Most of my ladies want to stay on it forever. It feels so good, you know? But I usually, and that's the beauty of going to somebody who can work with a compounding pharmacist, because, progesterone only comes in 100 milligrams or 200 milligrams. Whereas if you're taking a patch, you can cut a little piece off the patch and keep cutting it and taking less and less. But with the
Mm.
progesterone, you can't. It's a round ball with liquid inside, so you can't cut it.
Oh, you can't cut it. Mm.
No, no, there are very few pharmacies that can make it in pills, and they're so tiny that it comes to crumble. So then I compound the doses so that they can decrease both gradually.
Yeah, because I mean, I can't imagine someone just being on these hormones, they feel good, and then all of a sudden it just takes it away, and then their body freaks out or something. So,
That doesn't happen in everybody, especially people who've been on it for a long time, but people feel the decline. They feel,
okay.
they don't feel as peppy, they don't feel as sharp, they don't feel as moist, and they don't feel like themselves. Like one woman said, I don't have my effervescence anymore, so everybody
Ah,
describes it very differently. But, the hormones, they all tell me when they go on hormones, they got their life back or they feel like
mm,
themselves again. And so everybody, it's a choice. And I tell women, I only take you off if you want to go off, because some women, after they retire and they feel like they don't have to, y- you know, work so hard, or they don't have to be on top of their game, or they don't want to spend the money anymore because Medicare does not pay for hormones. So I find ways of getting it very inexpensively, but so some of them it becomes a financial issue, but um, I I don't necessarily, I leave it up to the woman. You're in control. You're in control. I
Hmm.
have someone in their 80s who does not want to go off. No way, no. I have several actually. They've been with me for a very long time, but there's no reason to go off.
Hmm. Well, my mother's mother, she's now passed away, but so my grandmother, from what I was told, she was on HRT for her bones, and she had amazing bones. They put her on HRT, and she was on it. My mom said she was on it for 40 years.
Yeah.
40 years, and they checked her bones. They were amazing. And I don't know if she ever went off of them or not, but that's why she went on them. And I'm just curious, like, let's say, for example, someone on menopause, they go on HRT for the transition, right? Going into menopause. And now they've transitioned out of menopause. They're maybe whatever, 70 years old, and they don't want to be on HRT anymore. That's fine, right?
Yeah,
They're not going
because
to
they
feel
built
any
bones. So like
effect.
if you start losing your bone in your 50s when you go into menopause, that's 20 years of bone loss. Whereas if you then go off in the 70s, you had that 20 years of keeping your bones strong and stable. So that if you start to lose, you're starting with a lot more bone mass. So you're not going to
Hmm.
have the same fracture risk.
Okay. And then, that was another question that I had too. Can can taking hormones impair your body to stop making hormones on their own? Does that make sense?
Yes, if you take too much, if you take too much, that can happen. But I'm not of the high dose school. I trained under like probably 6 to 7 different philosophies because everybody does it differently or everybody teaches differently. But it can, I see it more in women in the pill with the pill. Their hormones are like I measure them and they don't have hormones. I mean, they don't making anything. And the pill is substituting and it's turning off the feedback loop in the brain to make their own hormones. And like I said, it's a crapshoot when you stop the pill. Are the hormones going to come back or not? Some people it does, some people it doesn't. Some people it comes back right
Hmm.
away, some people it takes a while.
Yeah. Well, and I do feel like the benefits do outweigh the risks, especially now, the more information that we have as far as the studies, how to take it, pill versus patch and all of that. And I just think it's amazing what these hormones can do and help improve bone loss and help people with all these other issues beyond just reproduction. It's amazing.
Yeah.
Now, who shouldn't take HRT? Are there like a group of people that just shouldn't do it?
Well, if you've had a pulmonary embolism, that means you've had a clot deep in your leg and it went into your lungs. Even though we know the transdermal estrogen doesn't cause clots, pulmonary embolism, if you developed it when you were younger, and not, you made your own hormones, or even when you're older without hormones, your risk of developing another one is high. So I would never give it because you're at risk and they're always going to blame the hormones, whether the hormones increase the risk or not. So I think it's a little dicey to do that. Women who I am not comfortable giving hormones to women who have a history of breast cancer, but I do have colleagues that feel comfortable. The only reason I'm not saying it's good or bad, but I only do things that I have studied to death and have experience with, and I don't have experience with that. And that's not something that I study because every now and then I get somebody who wants to be on hormones that had breast cancer, and I just say, I'm not comfortable. Here's some names of here are people that may be more comfortable. And
Hmm.
it's like I said, it's not necessarily bad or wrong. And the other one is women with the BRCA gene. They're at a higher risk. So I've had some women who had double mastectomies and they're like, please bring on the hormones because I don't feel right. And I wanted my breast removed. Angelina Jolie did that. I want my breast removed so I don't have to have this Damocles sword hanging over my head
Mm,
to be worried all the time. So those
mm,
are the women that I don't give hormones now to. But there are other we're learning more about genetics, and there are other genetic factors, and I seem to be getting a lot of the rare cases that have issues that may increase the risk, but we don't know. And if a
mhm,
woman is
mhm.
saying, I am so miserable, I can't function, I am going to take the risk because living like this is hell, and I'm not going to take it. So as long as they're informed, because I don't have any definite proof it's bad, and I don't have any definite proof it's good. If somebody is miserable, I give it for compassionate care.
Yeah, I mean, quality of life is huge. Like I know a lot of people, they want to live a long time. They want to, but if you're living a long time in hell, it's like,
Yeah,
you know,
exactly.
it's insane.
And I have
Yeah.
had some women who had breast cancer and they're starting to get demented and they feel miserable and it's been treated and they're 10 years past and whatever. And when I get total agreement from the family and the doctors and they're just so miserable, if we all agree, then I have had one or two people that I did that for, but quality of life is really important.
If someone wants to work with you and they're listening, do you treat everyone in the USA, or do you only, are you specific to your region?
I'm only licensed to treat people in New York, New Jersey, Pennsylvania, and Florida. So one-on-one treatment. But what I did, because I get so many questions and people really need to learn how to take care of their body to balance their hormones on their own, I do many different online courses. And I'm doing a live course. I call it the Midlife Makeover. It's addressing all those factors that bring your hormones into balance. So I have a course called HRT for You, where people can evaluate themselves, like how is it impacting your life? What symptoms do I have? What risk factors can hormones help? What risk factors do I have that makes it a no-go? And then what can I expect when I go on hormones? And what are the studies that support it? And people love that because when they get people, like I had doctors really question me and almost like vicious attacks. And then when I could tell them like every study, they back down. They back down. Same thing with, you can't reverse bone. Well, I have so many cases of reversing bone and I have all these studies. So when they see that, they get a comfort level. So I have a lot of doctors now that refer to me because they say, I'd rather you do it.
Oh, wow.
Yeah, so I
That's
do a lot of
amazing.
teaching. I do a lot of teaching, and everything outside of those states, there's a lot that you can do because even if you do go to somebody who's not as well versed as I am, you can take care of all the other things around that make your hormone balance better.
Wow. Okay, so where can people find you online and on social?
Online, I have two. I have my teaching website, the Feel Good Again Institute, and I have my practice website, Vibrance for Life. On Facebook, I'm Lorraine Maita, Maita, MD. It's like Mai Tai without the I at the end. On Instagram, I'm at Lorraine Maita. LinkedIn, I'm Lorraine Maita, MD. And I'm not, I do, and I have a YouTube channel, and they took the Feel Good Again Institute. So I at the Feel Good Institute, Feel Good
Okay.
Again Institute.
Okay.
Yeah.
Well, we'll be sure to include all those links in today's show notes so everyone listening can just easily access them. And so people can find Lorraine there and just go to today's show notes and you can check her out. Thank you so much, Lorraine, for coming on today. We're going to have you back because I feel like hormones is such a hot topic, and it should be, and there's so much more to explore.
Well, thank you for having me, and I hope this helps somebody.
Thank you. Thanks for listening to this episode of Digest This. If you enjoyed this episode, please leave a review in your podcast app to let us know. If you're ever wondering how you can support me and this podcast, sharing it with your friends and family is the best way. This is a Resonant Media production produced by Drake Peterson and edited by Mike Fry. To email the show, message us at digestthispod@gmail.com. See you next time. The content of this show is for educational and informational purposes only. It is not a substitute for individual medical and mental health advice and does not constitute a provider-patient relationship. As always, talk to your doctor or health team first.